Welcome everyone. Thank you for joining us today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Today we are reporting an increase of 50 new cases of COVID-19 in Windsor and Essex County over the past 2 days. 12 are close contacts of confirmed cases, 6 are community acquired, 3 are outbreak related, and 29 are still being investigated. We have had 16,423 cases since the beginning of the pandemic. 360 people are active at this time, with 195 of our active cases being a variant of concern. To date, 1,643 preliminary or confirmed variants have been identified in Windsor-Essex County, with 92% of these cases identified as having the UK variant. 3 cases have the South African variant and 4 the Brazilian variant. 21 people are currently in the hospital, and we are reporting 2 ICU cases within Windsor-Essex County. Please note that this number does not include those transferred to Windsor-Essex from out of region. These people are tracked by their home region. To get the total number of ICU COVID-positive patients, you must contact the hospital directly. Our community has lost 424 people to COVID. There are currently 11 active outbreaks in Windsor and Essex County, 10 workplaces, 1 community outbreak. Now for the vaccine update, 246,632 doses of a COVID vaccine have been administered to Windsor-Essex County residents. 227,602 people have received at least 1 dose. Overall, 66.7% of adults 18 years of age and older in Windsor-Essex have received at least 1 dose of a COVID vaccine. Individuals 12 years of age and older are now able to book their vaccine appointment at one of our mass vaccination sites. Please book your appointment at wevax.ca or by calling 226-773-2200. People are also able to receive their first vaccine at a participating pharmacy or primary care provider. In addition, select pharmacies will be offering second doses of AstraZeneca this week to those people who received their first dose March 10th to March 19th. Please visit our website at wechew.org for further information. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning and thank you for joining us again this morning. Over this weekend, we vaccinated more than half of our residents in Windsor-Essex with at least 1 dose of the COVID-19 vaccine. While this is a good news, we continue to report daily COVID case counts in our community. More than half of these cases are variants of concerns. That continues to pose the threat that things can change quickly. Last week, the province unveiled their reopening plan by easing some restrictions for the Victoria Day weekend and further reopening plans that can start as early as June 14th. We must continue to take precaution while things open up again. People who just received the vaccine, they need to follow the precautions. People who have received the vaccines even more than 14 days before, they need to take precautions. Physical distancing with anyone who's not in your household is the single most important thing that you need to do to keep yourself safe. Please get your vaccine if you haven't taken it already. All the vaccines approved and available in Canada go through a strict regulatory requirement and are effective in preventing severe disease and hospitalization associated with COVID. We have seen effectiveness of both the available vaccine in our community, and there is no preferential recommendation for either Pfizer or Moderna. I heard that some individuals are refusing to take Moderna, and I want to take this time to assure them that Moderna vaccine is equally good compared to the Pfizer vaccine. All the seniors in the long-term care home and retirement homes received Moderna vaccine, and we can see the result right there. We're not seeing any cases in the vaccinated seniors in these homes. Please do not wait for one vaccine or the other. Get any of the vaccine that's available to you to ensure that you and your loved ones are protected. We all want to be ready to enjoy everything we want when the province starts to open up and when all our loved ones are vaccinated. We will soon start giving out second doses of the vaccine to ensure maximum protection for everyone. Please continue to follow public health measures until we get to the point. Please note that I will not be available for the YouTube session for the rest of the week due to other competing priorities. Thank you.
We'll now take questions from the media. Today we'll start with CFTV.
questions.
Any questions from the Windsor Star?
Yes, good morning, Doctor. Good morning, Teresa. Can you speak to demand for the vaccine currently, since it's now opened up to anyone age 12 and older?
I know that we opened up the booking system on Sunday morning to align with the provincial booking system as well, even though we're not on the provincial booking system. We have increased a few of our appointments throughout all of the sites this week, just a little bit to accommodate some people, but the majority of people will probably have to wait until May 31st or after that for, more availability. So the booking, we are always looking at our site and booking about 8 days out. So opening it up to those 12 and older, there will be limited availability until the week of May 31st.
And how do you feel seeing that? It looks like people still want the vaccine and they're still signing up to get it.
Yes, and we're working with we continue to work with the school boards. So we do have more information going out through our school boards and our partners at the schools. And we're working on some additional plans to offer vaccines for, those 12 years of older and their families. So yeah, the people are getting the vaccine. We want them to continue to access the vaccine at all of the sites, and we're happy that we're at 12 plus. It is a much simpler booking system now when you go online and you just have to press one button and it's for everybody. So it is a lot easier to book now.
And separately, Teresa, at the Health Unit Board meeting last week, you mentioned that two sites have been chosen for community consultation for safe consumption sites. Can you give us any more information, and can you share where those sites are that will be participating in community consultation?
Well, we're doing all of the preparation work, and we have an advisory committee, so we're not sharing the sites right today, but we will be obviously sharing the sites very soon because we want to do the community consultation. We also are working with our Board of Health to make sure that everything is in order, but we will proceed with the next step, which will be, disclosing the sites, locations, and doing the community consultation, key stakeholder consultations, businesses, residents, any people that are in that area. So more to come, but we do need to, we're following a specific process because both of these places, we would be leasing them, we're not purchasing them. And that we would need to make sure that there are, everything legally is in place because we will be submitting these, like one of the locations as a location with the application that has to go to the province and to Health Canada. So there's a lot more legal work to do as well. So before we disclose it, we have to get all of that in order.
Do you have a sense of when you might be releasing those locations?
I'm trying to think of what I have in store this week. There are a couple meetings this week about the CTS, and I would think that it will be, I'm going to say probably into next week, because that's the first week in June, next week already.
And then finally on the topic, are you confident that one of these sites will be able to go forward and we will have the safe consumption site in Windsor?
There are a lot of, a lot of work has gone into trying to meet the best, what is needed for our community and for people that would use the site. So a lot of the background work and criteria that is set out by the province, but also locally to see where people are actually injecting drugs and where overdoses are occurring. we hope that we have selected a site, and I believe we have, that would meet the needs of the people that would use this site. And we know it is in downtown Windsor because that's what our data is showing. And we've worked with many community partners dealing with mental health and addiction, and our community health partners are people that, positive pathways, all of our partners. So we have had a meeting with our advisory group, and all of these partners are on the group, and I think there is great interest in the two proposed sites. I believe one of those sites will be, will be the location. I think that, you're getting the culmination of a lot of work, and I hope that it moves forward. But we do have to consider all of the, the input from all of our residents and the businesses, and make sure that we address their concerns. So I don't want to say it's a given. I think both locations are good locations, and we are welcoming further input to make sure that the process is open and transparent. But either site would meet the needs of people that would use the site, I believe.
Thank you.
Any questions from AM 800?
Yes, good morning. I'm just wondering about the status of the mass vaccination clinics, in particular the ones in Windsor. Just wondering if those will continue operating, or if there are plans to set up just one bigger center somewhere.
So right now, we are having all those conversations. So as you know, our municipalities, the City of Windsor and the County of Essex, have been our valued partners in this. They are running essentially the mass sites in the county at the Libro and at Nature Fresh Farm Recreational Center in Leamington, and then the WFCU in Windsor. We are staffing all of these clinics with our medical resources, but the municipalities, these are sites that are for other purposes, and those conversations are just beginning to happen. It's a timing issue for sure. We want to make sure that we have as many people vaccinated as we can with first doses, and we will be beginning our second doses soon. And I think the conversations will be, what is that kind of date where first doses get picked up by our pharmacies and primary care providers, and then the mass sites continue to finish up all second doses. So there's still a lot of moving parts, and the date has not been, that transition date has not been determined, but we are making good progress on all accounts with our vaccine. We're opening up to 12 plus. This is a little bit earlier than we even anticipated last week at this time. So our intent is to get as many people vaccinated as possible with first doses, get the second doses moving along. And this requires further direction from the province. We're aligning all of our vaccination with their direction regarding the administration of second doses. So right now, for the majority of the population, it is still at the 4-month period.
Can you confirm that in the talks to look at where the mass vaccination clinics are operating, that one of the locations being looked at is to put it in the former Sears building at Devonshire Mall?
Well, I am not personally in charge of that, but I know there are discussions about Sears, and so I can't confirm everything that's happening because our health unit won't be leading a site, but the Sears building has been discussed.
Is that like a city decision, or who would make that call?
Well, I'm not part of those conversations, so it's difficult. We are aware, the health unit is aware, and you know, we will be supporting the site at Sears if it all moves forward, but we're not the ones moving it forward. So I'm not sure what to tell you. I guess who's ever in charge of it or the lead will be able to disclose that and give more information when they're ready.
So who is the lead on that?
So we are working together, as you said, that there's this partnership between us, the city, and the hospital. So we are all talking about it. There are a number of things that we need to figure out, and a lot of that is dependent on how many sites we end up in maintaining, what's the timeline, what's the availability. So we're not in a position yet. So I think it would be a collaboration between all three of us, at least if we're looking for a site in the city. And we'll share more details when it becomes available, but all three of us are talking and figuring it out, all these things.
Okay, thank you.
Any questions from CTV?
Just regarding the second doses for AstraZeneca, I know some people have concerns. They've reached out to where they got their first dose from, and some pharmacies are saying that they aren't getting any more AstraZeneca. So how many of those doses are available here in Windsor for the group that received their first dose from March 10th to the 19th? And where do people go to sign up? And are they allowed to sign up at a location where they didn't get their first dose at?
So I'll start and maybe Teresa can add. So I'll answer the last question first, that yes, they are able to sign up in places where they haven't received their first dose, and if it's available, they can sign up for it. The exact number or quantity of the AstraZeneca doses, I don't have that because we are still receiving some shipment from the ministry, and we're scheduled to receive more in the coming days. But we did our calculations, so it seems like we will have enough doses to meet the need for these individuals who are targeted, who got their vaccine between March 10 to March 19. So we anticipate that we should be able to meet that target. Not every pharmacies are participating, as you rightly identified, because of some of the logistical challenges and just the supply of the vaccine. But any pharmacies that are open, if you can find an appointment to get your second dose, if they're open, please do that. And if there is any additional shortage, we'll be talking to the ministry to make sure that we make that connection, and we try to get the additional or outstanding doses as quickly as possible to meet the need of our residents. I don't know, Teresa, if you want to add more.
Just to add that right now we probably have about, I'd say about 4,500 doses of AstraZeneca that are available to the pharmacies. And what we're doing on our website is that we do have a list of pharmacies that are giving vaccines out. And those that will be giving the AstraZeneca, we're going to actually put something on our website indicating that beside the location. So you'll be able to see exactly which pharmacies are participating in giving out those second doses of AstraZeneca. So we are just updating all of our website right now, and I don't believe it's up at this moment. I'm looking, but I know that was the discussion this morning, is trying to have it easy for people to go onto our website at wechu.org and look at the list of pharmacies that are giving out vaccine and see the ones that are giving out early doses, and then people are able to call those pharmacies. We are working with the participating pharmacies in delivering their vaccine directly to them today. So more to follow on that, but the majority of participating pharmacies will get their allocation today. And as Dr. Ahmed said, we'll just be using exactly what we received from the ministry, and if we get more, then we'll continue to provide more to the pharmacies.
Okay, is it safe to say by the end of the day, people will be able to find that information on the website, or?
Yes, I think that's safe to say. I think they're working on it right now. We were, having a discussion about having a whole separate list of pharmacies or just using our list that's already on the website and adding to it. So that's what we're going to do. We're going to indicate on our existing list of pharmacies that are participating so people will know who has the AstraZeneca for second doses.
Okay, great, thank you.
Any questions from CBC?
Good morning. Do you have any updates on the response to the survey on vaccinations outside of Ontario?
I don't have any additional information other than the earlier report that we shared, which was around 1,500 people, but I don't have an update on that, but I will ask our uppy about that and see if he can get some more information and see how many more people have responded.
I'm sorry, you're cutting out a little bit there.
So I'll just have to ask our EPI to look at that again and give us more information, and I can provide an update tomorrow because I don't have anything further than the initial 1,500 that I reported last time.
Thank you. How important is it to track that, given now that reopening is tied to our vaccination rate? Are you confident that you'll get an accurate picture of just how many people have gotten COVID vaccines elsewhere?
So it is important that we get that information for two reasons. So obviously one is for the safety and well-being of our community and how confident we are with respect to vaccine coverage rate. So as we report every morning that what is our coverage rate looks like from an overall all age included population as well as the 18 plus population. We know that we have a significant number of people who cross border for essential work, and we are anticipating that almost all of them, or if the majority of them, have been vaccinated fully with 2 doses in Michigan. And if we have that number, that would add up to our tally of what the local situation looks like. And then maybe we can target more and more on the groups that are where we see the vaccine uptake is low. So I think I'm more interested in knowing more about my community of what's going on, what the situation is, and to target some of the vaccination campaign rather than the provincial opening. But down the road, as we know, there's been a number of talks with not only the coverage rate, but also some restrictions and lifting some of these restrictions for those who are vaccinated. So at some point, they all need to get into our database regardless. So our survey will give us an anonymized data with which would be more focused on the coverage rate. But I think down the road, in the longer run, there has to be some kind of process that we get all these individuals into the provincial database or the federal database for Canada to ensure that some of these individuals, they can enjoy some of the activities as envisioned by some of the people, including traveling and attending events in the near future.
Thank you. And with regards to AstraZeneca, I understand that around 45,000 doses are set to expire in roughly a week. Are we getting those ones that are expiring soon? I'm asking because I'm wondering how pharmacies are expected to get everything in order, appointments, reaching out to those who are eligible, considering there's so little time to use that particular supply.
So I'll start and then maybe Teresa can add. So yes, we are getting some of those supply. We are also getting some additional supply as well, just to give out the second doses. And over the weekend, we worked with our team and with our pharmacy partners to land on a plan of how they will receive the vaccine. There are a lot of that is logistics on our end, that how we would supply these vaccines So some of the vaccines that our team will be working to deliver, and some of the pharmacists will be picking up the vaccines from here at our health unit. So a lot of logistics on that end, and I think the pharmacies themselves, they are trying to figure out how they will schedule the appointment, just like they have done in the past with the initial first doses. So we are confident that they should be able to do that. They are all ready. They're all motivated. They want to make sure that they are giving out the second doses to their valued clients, and they want to keep that relationship. So we're not concerned that they will not be able to use it. I think it's just a matter of making sure that we have enough supply that could meet the demand of the people. So it's just that part, as Teresa mentioned, that we have limited supply, but we will be getting more supply, and we'll be giving it out every doses that we have to meet the needs of the community.
Thank you very much.
Any questions from Blackburn?
Yes, good morning. What is the estimated supply this week? Is it still around the 17,000 mark? And is that overall for Windsor-Essex, or just what the mass vaccination clinics are giving out?
So obviously, I don't want to confirm the exact doses because it changes, but roughly you're about right. There may be some additional doses for the pharmacies and the primary care providers as more and more coming on board. So we don't have a confirmed final number, but it is estimated that it would be more than that, more than the 17,000, but I don't have a confirmed number for you. The province is distributing as many vaccine as possible to the regions that are ready. Our region has been ready right from the beginning with all these mass vaccination clinics, as well as the pharmacy channels and the primary care provider network. And that's why we've been prioritized many times to receive some of these pilot projects to roll out the vaccine. So we are anticipating that in the coming weeks, there will be more pharmacies that will come on board with Pfizer and Moderna that they're distributing, alongside with our mass vaccination clinic, to keep pushing out the vaccine as quickly as possible in our region.
And you spoke about appointment availability within the mass vaccination sites, mostly just looking at, nothing available, at least in Windsor, until next Monday. So how are the appointments being prioritized at this point? Because I noticed at Leamington, you can get appointments pretty much all this week. There are appointments open for vaccination.
So with the opening up of criteria 12 plus across all Windsor-Essex County, I think that just takes away that prioritization piece. So it's just a matter of the appointment slots that are available versus the demand, and recognizing that we have more capacity at our Windsor locations, all these sites, WFCU, Windsor Star Building, as well as St. Clair College site. These have large capacity, all these centers, and the county capacity are relatively lower than the city capacity. So it is not in our plan in any ways to open up these capacity in some way, just to meet the needs of the community. We're hoping that we'll continue to open up more site, and we're still much better, I must say, that compared to some of the other regions, when the regions are still struggling to give out appointment maybe 2-3 weeks in advance. Ours is still better. In 1 week time, there are a number of other pop-up clinics that are opening up in the community. We have got more of the pharmacies, and the pharmacies, they don't have I think a lot of them are simple and quick to book rather than waiting for a week time. So there are a number of opportunities, and it's unfortunate that we don't have like same day appointment or something like that. But from a planning perspective, I think it's really important that we keep all of these things as tightly controlled as possible, and we are not keeping any of the vaccines. So all the vaccines that are coming out, we are giving it out.
Like I said, a lot of appointments available even for Wednesday, Thursday this week in Leamington. Are any of those at the end of the day get pushed to Windsor sites where there's more demand?
I don't think that it would be possible to redirect some of these vaccines just from one site to another. I think we want to make sure that if we continue to see the same trend, then we'll have to maybe go back and think about it from a logistical perspective, that if we need to reduce some of the appointments in those sites. But I can't predict what that would look like. But we do watch those numbers, and we do keep that into consideration when we are planning for each of these clinics.
Thank you.
Any additional questions from CFTV?
I just have one. Which vaccine is it that they're distributing to kids 12 and under? Is there a specific vaccine?
So the only vaccine that's available to use in children 12 plus is Pfizer. Moderna is approved in individuals with 18 plus only. So right now, any child in Windsor-Essex 12 plus is getting only Pfizer vaccine.
Thank you so much.
Any additional questions from the Windsor Star?
Oh, thank you.
Any additional questions from AM 800?
No, thank you. Have a good day.
Any additional questions from CTV?
No, thank you.
Any additional questions from CBC?
Yes, I wanted to ask about the e-scooter pilot in the downtown. Do you see any COVID-19 risk with people sharing scooters, like the equipment itself?
Good question. We haven't come across with any challenges. I think just like any kind of shared equipment that people use, there could be an indirect transmission risk. And I think I would advise that anyone who's using it, if there's no cleaning in between, to take their appropriate precautions and clean it up before they use it. But something that we'll have to look more carefully. But I would say that if I have to use it, I'll either clean it first, wipe it down before I use it, or I would not use it, knowing that a lot of the time these e-scooters, if it's outside and in the sun, there may be some protection from a UV radiation perspective that it's already the virus may not survive on the surface for that long under the hot and humid temperatures. But again, I would anticipate that people, if they're using it, they use it after wiping it down for their own safety.
Thank you very much.
Any additional questions from Blackburn?
No, thank you.
Thank you, everyone. Have a good day.